Good evening, Prof. Always great to chat to you. I understand that our recovery rate from COVID-19 is around 90%. I don't understand that. Please explain how it's calculated, because over 98% of people who get COVID-19 in South Africa do not die. So surely our recovery rate should be 98%.
Well, Sally, actually, you're completely correct. So the default recovery rate from infection with the virus is probably in the region of 95 to 97%. That is your default rate. As we know, roughly about 60% of people that are infected are asymptomatic, and obviously that means they would recover. Of the people that do become symptomatic, 85% would have a mild illness which won't require hospitalization, and they would recover on their own. So the recovery rate is sort of a difficult measure to use to determine just how well you're doing. Much more informative is what is the case fatality rate of people that are hospitalized. And in fact, the case fatality rate of people that are hospitalized in South Africa is not very different from what it is elsewhere in the world, in the region of about 14%. So I don't think there's anything exceptional in terms of how well we're treating people. We're doing as good a job as is being done in Europe, in the United States, and that is the case fatality rate for hospitalized cases. A more important metric in terms of trying to compare between populations is what is known as a mortality rate per 100,000 of the population. South Africa's
You've just broken up slightly. As you were telling us about the mortality rate as per 100,000, you've slightly broken up. So just start that sentence again. You were saying that a better measure is the mortality rate per 100,000 members of the population, and we're doing quite well there. Just tell us those figures, please.
Correct. So in South Africa, using the data from the South African Medical Research Council, which looks at excess mortality, the most likely mortality rate from COVID-19 in South Africa is about 65 per 100,000, which is just round about the same what it was after the first wave in the UK, in France, in Italy, where it was in the region of 55 to 60 per 100,000. So we're sort of in the ballpark of what the mortality rate has been in Northern Hemisphere countries. But the one big difference is that it appears that the percentage of the population that's been infected in South Africa is much greater than what happened in Europe after the first wave. And that would mean that for some reason, what has happened in terms of large numbers of infections hasn't necessarily translated into excessive number of death as well as hospitalization from COVID-19.
Is that because of our young population? I mean, so in other words, quite a lot of us have probably got immunity. However long that lasts, of course, is still up for research. Does that suggest that it's because of our young population, perhaps, that we were able to withstand the disease better?
So certainly that is one of the hypotheses that's been postulated. But I think in the South African context, the younger age group demographic is somewhat offset by the high prevalence of diabetes, obesity, hypertension. So I don't believe that it can just be explained by the younger age group in terms of our demographics. I think there is something else at play. And right now it's really speculative in terms of what the other thing is. One of the possible things which we are currently investigating is whether, for some reason, people in low-middle-income countries where there's a high density of population might be more commonly infected by what is known as a common cold coronaviruses. And it is possible that the immunity that's induced by this common cold coronaviruses, although it won't protect one from being infected, it might actually protect one from progressing to severe disease after being infected. So that is one of the hypotheses which is currently being explored.
Why would we have had more of those infections and therefore a little bit more robust to withstand this than in other countries where people live in close quarters, they travel on the underground all the time? Why would we be more robust and have been more exposed to those other forms?
So much of it might relate to what's happening in children. And it is possible that children in low-middle-income countries are more likely to be infected with this virus more often. So as an example, in studies that we have done in the past in Soweto, we have found that 1 out of every 5 children under the age of 5 would be infected with these common cold coronaviruses. And in that sort of scenario, those common cold coronaviruses will be transmitted to the adults as well from the children, and hence the adults will also develop some immunity. But I need to emphasize this is a hypothesis, and it's really what trying to explain what has been observed in South Africa, where the waning of the epidemic is very different in terms of its reason compared to why the epidemic waned in the Northern Hemisphere countries during the first wave.
Well, it's absolutely fascinating hypothesis, and it does sort of indirectly link back to the fact that we've got quite a young population. We know that on Thursday our borders are due to open. That's a whole new layer of complexity. We know that a lot of our figures are looking good. Our reproduction rate, I understand, is 1 or just below. And a lot of our other scientific measures for which, whether you can go to a certain country, we're looking good on that score. How do you think we're doing? Do you think that we are going to be able to safely reopen our borders, that a lot of people will want to come here because it's looking safer for all the reasons you've mentioned? And do you think we're going to be able to stop re-importing the virus?
Well, I can't speak about whether people are going to hurry to come to South Africa, but I think South Africa is certainly in a much better space than where they are currently in Europe. In terms of the threat that's posed by people coming into the country, in fact, the threat that poses is actually very nominal. The reality in the South African context is that if there is a resurgence, it's not going to be because of a few imported cases from outside, but rather because of dissemination of the virus within the country when people become more complacent with regard to wearing a face mask, mass gatherings, social distancing, etc. So those are the factors that are probably going to influence a resurgence rather than importation of cases from outside the country. South Africa is not like New Zealand or Iceland or Australia, which have been able to contain the spread of the virus at the early stage. We're in sort of a very different phase of the epidemic, so there's much less threat in terms of imported cases fueling the next resurgence of the virus.
Well, thank you very much. Fascinating chatting to you. Wits Professor of Vaccinology, Professor Shabir Mahdi.